Good evening and welcome. My name is Marcy Taylor, and I am chair of the Zeta Phi Beta Sorority Stork's Nest. Just a little bit of history. Zeta Phi Beta Sorority and the March of Dimes has a respected and enduring partnership and legacy of addressing issues of prematurity, birth defects, and infant mortality. Now, the March of Dimes has identified November as Prematurity Awareness Month, and the entire month of November we are doing Moms Stay Woke Part 3, which is conversations for young women about childbirth. And we also want to thank Nurse Family Partnership for partnering with us during November for Prematurity Awareness Month. This is happening every Wednesday in November at 6 p.m. And for the moms, if you attend at least 4 of the sessions, you'll be entered into a drawing for some swag. It's going to be some NFP swag. It's going to be a self-care kit, $20 in gift cards to Generations Adventureplex, gift card for a manicure at Nailed by D, and a $100 gift card to Therapeutic Indulgence. Now, in case you missed the first 2 weeks, week 1, we talked about preeclampsia with NFP doula, certified doula Marshall. Last week, we talked about preterm labor with Christina Imch. This week, we're going to talk with a NICU nurse, Maggie Erickson, and I'll be introducing her in a few minutes. Next week, we're going to have a couple of mom stories with 2 young ladies. And on week 5, we're going to have support groups. We're going to talk about the doula program, connecting kids to coverage, and tobacco cessation. At the end of each session, we're going to have a question and answer if anyone has any questions. So with that being said, I'm going to go ahead and ask everyone that's on to introduce themselves. And who would like to go first? Let's go with NFP. Let's go with Rochelle.
All right. So I am Rochelle Andruskevich. I am the nurse supervisor for Nurse Family Partnership in our Tri-County area. So we cover Elkhart, St. Joe, and LaPorte counties. Prior to being the supervisor, I was a nurse home visitor with the program for just over 2 years, and absolutely love what we do. So Maggie is going to speak about the NICU nurse perspective this evening, and then I'll say a little bit about safe sleep.
Okay, very good. Carrie?
Hello, I'm Carrie. I am one of the nurse home visitors for Nurse Family Partnership in Elkhart County. And I've been with Nurse Family Partnership for, since May, and it has been one of my most amazing jobs I've ever had. I really feel like it does a lot for our moms and for me, and I've appreciated the program quite a bit.
Thank you, Carrie. Now we're going to introduce our 3 moms. Let's start with Kaylee. Tell us when your due date is, if you know you're having a boy or a girl.
I'm Kaylee. I'm having twins, and I'm due roughly February 21st.
Thank you, Kaylee. Carla?
Hi, my name is Carla. I am having a boy, and I am due January 31st. Yes.
Thanks, Carla. Dee?
Hello, I am Dee Williams, and I am having a little girl, and she is due January 8th. So I have about 8 more weeks.
Yes, yes. And then we have the president of our South End chapter, Alice.
Good evening, everyone. My name is Alice. Welcome to our session tonight, and thank you for your time.
I want to thank everyone for being on. Now let me introduce the speaker for this evening. We have Maggie Erickson. She has been a nurse for 33 years. Most of that time has been spent in maternity care. Most recently, she has been working with the NICU, supporting families whose babies need extra support after coming into this world. She truly has a heart and passion for this work. Now, Maggie and her husband, they have been married for 35 years, and together they have a son and daughter who are grown and tackling life's adventures. Maggie loves her family and friends fiercely and would do anything she can for them. And she also has a love for all things Snoopy. Maggie.
That is very true. Thank you so much, Marcy, for that introduction.
You're welcome.
I do have a love for all things Snoopy. So as Marcy said, I have done nursing for 33 years, most of it in maternal child. I started in labor and delivery at a small hospital. That hospital did what we call postpartum care, or it's more like all-inclusive care. So we would labor, deliver, and then we would care for that mom postpartum if we could. It wasn't a true LDRP, but we tried our best to always have the nurses follow their patients, which makes it very nice for the patient. I left because I wanted to try something different, and I felt like I could make a difference in the NICU setting. I have been there for 7 years now, and it has definitely been an eye-opening experience. As far as the NICU goes, a few things that I feel that pregnant moms should know is, first and foremost, it is a godsend if you truly need the NICU. The NICU is there to help support not only your baby that may be having issues, but you and your partner or your family. The NICU usually has a lot of rules and regulations about who can come and who can visit and who can do things, but it's truly geared toward protecting our littlest patients. As far as, I was listening to Marcy talk about some of the topics you guys have already had. Prenatal care and preterm labor were two topics that you guys have talked about already. So you probably know the extreme importance of getting prenatal care and trying to ward off preterm labor so that you don't come visit me in the NICU. Moms that take care of themselves often can ward off some of the things that cause preterm labor, but there is a small population of women that have preterm labor that we have no idea why they had preterm labor. If you would happen to become a NICU mom, what you would be looking at is a baby that was born early or a baby that was born with some difficulties, needing specialized care. In that unit, to provide that specialized care, you're going to be very overwhelmed when you walk in. We have many monitors, many beeps, sounds that are constant, that are sometimes annoying not only to the patient, but to the staff members, but they have a very important role in what we do. You're going to see a unit that has many nurses, respiratory therapists. We have nurse practitioners, and we have physicians around most of the time. We also have things available to parents, such as social workers that are there to help you get used to why you're there, what's going on there. And we have lactation consultants. We have mom postpartum program where we can talk to the moms about if they're having trouble with depression, or if they're adjusting to having a new baby that was born prematurely or needing extra help. So one of the first things, like I said, that you're going to be overwhelmed. Your baby is going to always be on a monitor if they're in the NICU. And that is done so that we can keep a very close eye on these babies, because many babies, especially those that are premature, because like I said, some babies are just there because they're sick, but the premature babies, they can have a lot of changes in their heart rate, their respiratory rate, or their oxygenation level. And we want to keep a very close eye on those things for your baby to make sure we're taking great care of your baby, or in Kaylee's case, babies. We also have many babies on IV fluids, but we do try to get babies off of IV fluids as soon as possible and get them onto mom's milk. You're also going to notice that there's a lot of routines in a NICU. And what I mean by that is, if you are on a standard postpartum unit, you're going to see the nurses come in when they check you a couple of times a day. And you're also going to see the nurses coming in if you call them. Outside of that, you don't have to be bothered very much. However, in the neonatal intensive care unit, you get a lot of attention. So we are in the baby's room, rounding on the babies almost hourly. sometimes 2 hours if we're trying to let mom get a little extra sleep, or if the baby needs the extra time to be left alone. And then we have routines like doing their vital signs, listening to their heart and lungs, feeding them, changing diapers, all on a routine of every 3 to 4 hours. And that is done again because these babies usually need care in a pretty regular manner so that we can adjust calories if we need to, we can adjust therapies if we need to, but your baby will have eyes on them pretty much constantly. The NICU is a wonderful environment if you're scared, but it also can create some fears for you. If you're scared about how your baby's doing or what's going on with your baby, there's often many people around that can walk you through exactly what they're seeing, why they're seeing it, potentially give you a cause, what caused it. Sometimes, you know, we can't give you a cause, but we can treat their symptoms or what's going on. We have staff that are very willing to talk to parents at all times. And the NICU that I work at, we have a model of care that we call couplet care, where if you were still a patient as a mom, we may be taking care of you and your baby at the same time. Our NICU is set up as, for the most part, single patient rooms. We do have some rooms that have to accommodate 2 babies, but typically those rooms are for babies that have parents that are either not involved because they choose not to be involved, or not involved because they can't be involved for one reason or another. Being a NICU nurse requires a lot of faith in your staff around you, faith in your coworkers, and faith in the treatment plans that we give our babies, because we are very invested in our babies from the minute they walk through our door. Just like you guys are very invested in your babies from the minute that they come. One of the things that I think sometimes is hardest is we feel sad for those of you that cannot be there with your baby, such as if you have another baby at home, maybe your children are very close in age, maybe you're a single mom and you have no support, maybe you have transportation issues. There are many reasons that parents cannot be in the NICU with their babies. We do have a social worker that tries to help alleviate some of those things, such as in the state of Indiana, if you're on Medicaid, I believe it is, you can get vouchers to travel back and forth to see the baby. So that helps some moms. Let's see, we have a setup where the parents, mom, dad, or mom's partner, if she chooses somebody else, significant other, can stay there with the baby throughout their whole stay. If they choose, they never have to leave. We involve them in as many aspects of the baby's care as we can. So I guess the biggest thing that, if I was sitting here advising pregnant patients every day of the week, like Rochelle and Carrie do, I would be saying, take care of yourself, take care of your baby while it's in utero, so that you do not have to visit me, because you don't want to have to visit the NICU unless you have to. I have many parents that have told me statements that have not left me since I've been there. And I'm going to give you one example. Baby J, we'll call her, was born at 24 weeks gestation, which is barely over half of the pregnancy. So when baby J was born, she got all kinds of lines. She was intubated through her trachea to have a ventilator to help her breathe. And she was very, very sick. A big part of that is because she was born so early. Baby J's mom was sick herself, but as soon as she could come to be with baby J, she was there all the time. Baby Jay's mom and dad both worked. And so one of the first obstacles was, should I take my maternity leave right now and go back to work? Or should I go back to work and take my maternity leave when my baby comes home? But one of her biggest obstacles that she told me that I have not forgotten, Baby Jay just celebrated her 1-year birthday. She is still in a hospital. She is not in our hospital any longer because she had to have surgery that we do not do. But Baby Jay's mom said to me, I never knew that the clothes and the things that I bought to set up my nursery would not be used. And that was kind of an eye opener for me, because you moms have, you know, maybe a baby dresser or a basket set up with maybe your baby's clothes in it, and you've got these little newborn clothes, and before you know it, a baby like Baby Jay is a year old and none of those clothes will fit her. And so I guess it, you know, the NICU has its downsides. And like I said, people like Carrie and Rochelle are helping you guys to take care of yourselves so that you don't have to come and see me. But it is a wonderful place if it's needed. I guess I'd really like to hear if you guys have any specific questions about the NICU or anything. Have you ever been in a NICU, and anything you'd like me to talk about in particular?
I have a question, Maggie. So would a parent be able to touch and hold their baby if they're in a NICU unit?
Absolutely, Marcy. When babies are born at an extremely early age and they weigh a pound or maybe a little less than a pound, we usually have a 72-hour window where we have to very carefully move that baby to prevent brain hemorrhages. Even during that first 72 hours, we feel it is important to put that baby on that mommy. So we will do certain maneuvers to keep the baby's head in a certain position, and we will place that baby skin to skin with its mother. Ventilated, doesn't matter. We do whatever it takes. If the baby cannot be held, we are opening up the isolette. Moms and dads and significant others can put their hands within the isolette and touch that baby, because it is very important to the parents and the baby. That's a great question.
Thank you. Any other questions?
I just have a comment from my time working in the hospital. And just from having heard this numerous times about, well, my friend gave birth at 34 weeks and her baby was just fine. So if I deliver early, my baby will be fine too. But I think Maggie can probably attest to, you can have two babies that are even born full term, and one may need that extra support and one may not. So just because one baby did fine being born early, another one may need a lot of support.
That's very correct. I have, in the past couple months, I can give you a couple good examples. I had a 10, almost 11 pound baby that I was caring for in the NICU. That baby was born to a diabetic mother. So that's why that baby was so large. And that baby's blood sugars could not be self-regulated. So we were taking care of that baby, putting IVs in her and feeding her through a tube that goes into her nose to keep her blood sugar stable, because her mom couldn't have done that if she'd wanted to. And then I also recently had a baby born at 35 weeks. He was such a tiny little peanut, but mom had gotten some steroids and things like that. And so that helped him. And he did very well. And he was home by the time he was 37 weeks gestation. But that does not happen all the time. As Rochelle said, babies can be full term and come up to the NICU. And you're exactly right. A lot of people are like, I'm tired of being pregnant. I want this baby or babies out. And we understand that. Anybody that's had a child understands that the end of pregnancy is uncomfortable and people are done. But if you have the capabilities to take care of yourself and keep your babies in even longer, it is certainly advise that you keep them in all the way to term.
Do you have any suggestions or tips for these ladies?
My biggest suggestion is to get prenatal care. However, I will say that one of the things that we see quite often in my NICU are moms that are addicts, and being an addict is very difficult, but there are programs out there to help these moms. And these moms can get on a program to do what's best for their baby and themselves to help them break their addiction. The babies can be treated when they come out, but while babies are still inside, mom's getting that care. And a lot of moms will think, well, if I go through treatment, my baby's going to be fine. I won't have an issue. And unfortunately, that's not true. Even moms that are on treatment, their babies can come out and have addictive behaviors and show us some symptoms of something called NAS, or neonatal abstinence syndrome. And that's because once that cord is clamped, they've now lost their supply of drugs that they were getting. So I guess that would be my other big suggestion, is if you or anybody you know is pregnant and you know that they are addicted to something, help them get into a treatment program, because they are out there. And addiction's tough. People can't do addiction by themselves.
Okay, thanks, Maggie. Any other questions?
Mm-mm.
Nothing? Okay, Rochelle, you're going to talk about safe sleep.
I am. So over the last few years, the big thing about safe sleep has been the ABCs. So of the 3 pregnant mamas on here, does anybody know what the ABCs of safe sleep are?
No, haven't
No.
been told.
Carla, you got a smile on your face like you want to say something.
I do, but I don't remember like exactly what they are, but I did, like, I know what they are, but I don't remember the name of it.
That's okay. So do you mind
'Cause I
telling
went
me
through
or sharing
a-
what you know?
Because I went through, I want to say it's a class through the program I'm with. I remember attending it, like, because I had it yesterday, but I don't, like, because we was talking about like the whole breastfeeding thing, and then the preterm labor, and a whole bunch of other things.
Yeah,
But I'm
no
familiar with it.
Yeah, no worries. So the ABCs, A stands for alone. So your baby needs to be alone. B is for back. So baby should always be placed to bed on their back. And C is for crib. So crib, pack and play, bassinet. So they need to be alone, on their back, and in their own sleep space. If you are bed sharing, that puts your baby at greater risk for SIDS. If you have stuffed animals or pillows or blankets, those are all things that can cover your baby's face and increase that risk of sudden infant death syndrome. So we really want babies to be alone, on their back, in their own space. And I wish I had brought our baby, Carrie. We have this new baby that is an awesome example for safe sleep. It actually, the baby comes in half, and I know that sounds weird, but it allows you to see the trachea and the lungs and the stomach. And so if the baby's on the back, the stomach fluids stay in the stomach. If the baby's on its tummy, the fluids from the stomach start to come up that esophagus and can actually come around and into the trachea and down into the lungs. And so that increases the risk. The other thing is you don't ever want to put baby in any inclined position. So car seat, swing, anything like that, because your baby's trachea, so their windpipe, is only about the size of a drinking straw. So, and I wish I had one with me, but think about how easy it is to bend a straw and cut off any flow through that straw. Your baby's trachea is exactly the same. So if their head comes down, they could easily occlude that trachea, and then we have, their oxygen levels drop very quickly. So very important to be flat on the back, alone in a crib or bassinet, pack and play, any firm surface, no pillows, blankets, or stuffed animals. Any questions?
Because Carrie is my nurse, so she's talked to me a lot about that when she comes to visit. So I know some about the safe sleep
and there are, if any of the moms on the call need access to a safe space to sleep for your baby, I think in St. Joe County, Carrie, do you happen to know, or Maggie, off the top of your head, do you know in St. Joe County where they can get, I think the health department might be one of the locations that gives out pack and plays, but I can definitely get that information.
I think WIC does through the Babe store and everything. Yep. I think that's where a lot of our moms get them.
Yeah. I know our program had them at one point, but we are currently out.
So I want to give kudos to Kaylee because she has 2 pack and plays, one for each baby.
Good. And that's important too. Even with twins, you want those babies to have their own safe sleep space.
Great. Any questions, ladies?
Nope.
Carla, no. Dee, any questions?
No,
Okay.
not at the moment.
All right, no problem. Well, with that being said, Rochelle and Maggie, I want to thank you for giving us information on the importance of the ABCs of safe sleep and SIS and what happens in the NICU. If there is no questions, I want to thank everyone for coming to our 3rd week session of Moms Stay Woke. And just remember, next week, we're going to have 2 moms tell their stories. And on week 5, our last week, we're going to talk about support groups and programs. And just remember that if you attend 4 more of the sessions, you'll be entered into the drawing for that swag. And if you miss any of the sessions or you want to go back and hear something maybe that you have missed, we have week 1 and week 2 sessions uploaded on our YouTube page, which is South Bend Zetas, right? Is it South Bend Zetas? Okay. If there is no questions, I want to thank everyone for tuning in, and we'll see you next week.
Thanks for having me.
Thank you, everybody.
Maggie. Thank you, Rochelle. Bye.
Bye.
Bye-bye.